downloading the free TuneIn app. Once you do, search Rainier Avenue Radio. And remember, do not curse out your fellow drivers. This has been your Rainier Avenue Radio traffic update.
This is Tyrone with God Is, an inspiration of gospel music, also on Rainier Avenue Radio.org. We give out free food each and every Saturday from 11 to 2. And so we want you to come on out and support us when we love on your community. And we also have a fish fry once a month. We want to raise funds, put back into the community. And so come on and support us. We need your love. And also, if you want to be connected with us, go to Rainier Avenue Radio.org, to the website, Facebook, Instagram, and God Is. And as God Is got a website, we need your help, community. So come on out and get your free food each and every Saturday it is. And so we asking for donation, whatever you feel to give from your heart to the mind. And as we doing it right here for you, go to our website and touch love and give back. And so come on by 810 23rd Avenue, Rainier Avenue Radio.org, your community radio station and inspiration of all the things we do in your community.
We got the feeling now?
Yeah. R&B, soul, funk, 50s, 60s, 70s, 80s. We give you all that and more on Star Time. Join me, Paul Pearson, for a 2-hour trip through the history of R&B. A new episode every week on Wednesday at 2 p.m. Come and get the feeling on Star Time on Rainier Avenue Radio.world.
If you or a family member are 55 or over and need nursing home level care, but want to keep living where you are, check out Providence Elder Place PACE. This program offers healthcare, housing, transportation, and recreational activities. There are no co-pays or deductibles, and it's covered through Medicare and Medicaid. Providence Elder Place PACE works to keep you healthy and in your home. Call 206-320-5325 or visit providence.org Elder Place. Providence.org Elder Place. Yo, what's good? It's D-Money, and you should definitely check out Fresh Juice every Wednesday, 9 to 11 Pacific, right on Rainier Avenue Radio.
With pint-sized Patron, P-Treasy the Don. Y'all be sure to clean your mirrors as we play brand new hip-hop and R&B from locals and worldwide.
It's ID Yourself, a.k.a. Malcolm Flex. Make sure you check out Fresh Juice every Wednesday, Pacific Standard Time from 9 to 11 p.m.
And to get those exclusive interviews that we be doing.
Sipping a brand new Fresh Juice every single week.
Yeah. Every Wednesday, 9 to 11, Rainier Avenue Radio.
Yeah, yeah.
Hi.
You know you can't get enough of Rainier Avenue Radio.world.
There you go. Yeah. That's the better.
Feel free.
This is Tony B. We are live at the tent in Columbia City. We're expecting a press briefing with new announcements about the issues concerning vaccine hesitancy, and the vaccine mandates that are in effect. And we anticipate that we will be starting this very shortly. So stay tuned. Once again, you're live on Rainier Avenue Radio.world. We are at the press briefing that will take place shortly from the organized by the King County Executive's Office. The Mayor of Seattle will be here, along with Public Health Officer Jeffrey Duchin, a representative of the King County Executive's Office, and we will begin this briefing very shortly. Once again, this is Tony V. We are live at the tent in Columbia City. We'll be bringing you the press conference regarding vaccine hesitancy, vaccine mandates from the King County Executive's Office. Mayor Durkan is supposed to be here along with the Public Health Officer, Jeffrey Duchin, King County Executive. Constantine may be here as well. And the press conference should be starting very shortly.
How you doing?
All right.
How you doing? Brother, I saw you already.
Thanks for listening to Rainier Avenue Radio. You are live with me here in Columbia City at the tent in Columbia City on the corner of Rainier and Ferdinand. This will be a press briefing regarding vaccine hesitancy, vaccine mandates, and this is put on by the King County Executive's Office. Mayor Durkan will be here along with King County Public Health, Seattle King County Health Officer Jeffrey Duchin. And then I believe that King County Executive Constantine will be speaking as well. Should be starting any moment, and we are going to stay here for the start. I do see King County Executive Constantine. And I think we're about to begin.
Well, good afternoon. I'm King County Executive Dow Constantine. We've reached a critical moment in the long fight against the pandemic, one that will determine how quickly and how safely we will emerge. Hospitals in King County and all across our state are at their highest occupancy rates, admitting more COVID-19 patients now than at any point since the pandemic began more than a year and a half ago. In fact, earlier today, Public Health, Seattle and King County had to provide guidance to our region's hospitals on how to plan for additional morgue capacity. COVID continues to adapt and become stronger, and so must we. The good news is we have effective tools now that we didn't have at the start of the pandemic, including safe vaccines that are free to anyone 12 or over. Because 85% of King County residents have received at least their first vaccine dose, among the highest of any major metropolitan region in the country, we're able to apply a verification policy that will keep people safe and keep businesses open. Today, I'm announcing a new local health order. It will require proof of an approved COVID-19 vaccine or a negative test to enter certain businesses and venues beginning on October 25th. Our public health officer, Dr. Jeff Duchin, will provide details in a moment, but this health order will apply to these main categories: outdoor, recreational, and entertainment events with 500 or more people. So that's including professional and college sports and concerts. Indoor recreational and entertainment establishments, regardless of size, including performing arts centers, movie theaters, gyms, and convention centers, and indoor restaurants and bars. We developed this policy after conducting extensive engagement with a wide range of experts and stakeholders and community leaders, and they helped us develop a plan that is based on science, that keeps businesses open, and that promotes an equitable recovery. I want to make one point clear. The reason we are able to apply an approach that achieves these multiple goals is because the vast majority of King County residents have gotten the vaccine. Otherwise, we could potentially be looking at having to go back, having another lockdown. I want to thank everyone in King County who has been vaccinated already, and I encourage everyone else who is eligible to do the same. Your life and your health and the health of our community and our economy depend on it. I want to thank our healthcare professionals and our public health employees for their tireless work over the course of more than a year and a half to keep us all safe. And that includes our own public health officer. Please join me in welcoming Dr. Jeff Duchin.
Good afternoon. I'm Jeff Duchin, Health Officer, Public Health, Seattle and King County. The Delta variant has fundamentally changed the course of our COVID-19 outbreak and how we must respond to it. The virus is airborne, and it's wickedly contagious, more infectious than earlier variants. It spreads readily indoors, and when masks are not worn, causes serious illness and is not adequately controlled. Washington State is experiencing all-time high levels of COVID-19 cases and hospitalizations. In King County, we continue to experience high rates of community COVID-19 transmission, with hospitalizations at their highest levels since January, and deaths are increasing. COVID-19 case rates are highest in 18 to 49-year-olds, and unvaccinated people are at greatest risk, especially for severe illness. Last week, 154 King County residents were hospitalized on average with COVID-19. That's one person hospitalized every hour. One King County resident is currently dying from COVID-19 every 8 hours. Over the past 30 days in King County, compared to vaccinated people, unvaccinated were 7 times more likely to be diagnosed with COVID-19, 41 times more likely to be hospitalized, and 42 times more likely to die from COVID-19 related illness. Our regional healthcare system is under serious stress and overloaded from increasing hospitalizations and critically ill patients needing ventilators to breathe, including an increasing proportion of younger adults and pregnant women, some delivering their babies in the intensive care unit. No pregnant woman should have to deliver a baby prematurely while on a ventilator in the intensive care unit, and no child should have to start their life that way, because COVID-19 is preventable through vaccination, the single best option for protecting individuals and our community. I want to thank Dr. Chris Murray's team at the University of Washington's Institute for Health Metrics and Evaluation, especially Dr. Ali Muqdad, Dr. Bobby Reiner, and James Collins, who provided us with a report that models the projected course of the COVID-19 outbreak in King County over the next 6 months. It estimates the impact of vaccine verification for entering restaurants, bars, and gyms on COVID-19 cases, hospitalizations, and deaths. I'll briefly summarize results, and I very much appreciate that Dr. Murray is here today to answer questions about the report. It will also be available online. First of all, it's important to understand IHME projects our outbreak to worsen in the next 6 months. In the absence of vaccine verification, IHME projects that over the next 6 months, there will be 300,000 new infections in King County, 164 of which will be diagnosed and reported, compared with 145,000 total reported to date. And there will be approximately 8,000 new hospitalizations, compared with approximately 7,700 total to date. And there will be up to 1,000 or more additional deaths. The peak of the winter surge is expected to be mid to late December. Now, on the other hand, IHME concludes that vaccine verification in King County will prevent substantial numbers of infections, hospitalizations, and deaths. Over the next 6 months, IHME estimates that vaccine verification at restaurants, bars, and gyms alone could prevent between 17,900 and 75,900 infections, between 421 and 1,760 hospitalizations, and between 63 and 257 deaths. That's preventing between 10 and 43 deaths on average each month from vaccine verification in restaurants, bars, and gyms alone. In the model's maximum effect scenario, vaccine verification can prevent up to 20% of infections, hospitalizations, and deaths. And it's important to note that the report does not include any health benefits of vaccine verification at entertainment venues or the large indoor or outdoor events where vaccine verification will also take place. And that's only due to constraints around the model, and that may be improved upon in further reports. It's also important for me to recognize that these estimates are based on the best currently available information and include a range of uncertainty, and they will be updated as new information becomes available about the epidemiology of the outbreak and the impact of mitigation measures. But clearly, our COVID-19 response must continue to adapt to the changing reality of the evolving pandemic. With Delta, the virus has gone on the offensive, requiring us to use layers of protection. Facing the reality of an unwanted, resurgent pandemic is difficult and unpleasant. I know we're all fed up with COVID-19 and the hardships that this pandemic has brought. I hear you. I'm feeling it as well. But if instead of taking stronger measures, we give in to fatigue and frustration, it's our own families, friends, and community members, particularly the most vulnerable, who will pay the cost, suffering unnecessary and preventable infections, hospitalizations, and deaths. And I know no one wants that. Most importantly, we need to pay attention to the number of serious infections and the resulting threat our hospitals are facing and safeguard our healthcare system so you can get the care you need, including life-saving care when you need it and whatever you need it for, whether it's COVID-19, for a heart attack, a stroke, cancer care, or a serious accident. For these reasons, King County will require verification of full vaccination status or a negative test to enter outdoor public events of 500 or more people and indoor entertainment and recreational establishments and events such as live music, performing art, gyms, restaurants, and bars. These requirements will go into effect on October 25th for outdoor venues in the majority of the indoor establishments, and December 6th for restaurants with seating capacity of 12 or fewer who need extra time. And this gives people time to start their vaccination series or complete their vaccination series, and it gives venues time to prepare. Vaccination verification requirements will reduce the spread of COVID-19 in high-risk public settings, prevent COVID-19 cases, hospitalizations, and deaths, and help stabilize the healthcare system and return patient loads to more manageable levels. It will make businesses and other public venues safer for customers and workers and our community. And by decreasing COVID-19 spread, it will also decrease the risk for our children. And this is especially important until vaccine becomes available for those 5 to 12 years of age, which should happen sometime this fall. Taking these steps to stop the spread of COVID-19 now should also help reduce the risk of potentially more disruptive. I want to be clear that this order is not intended to be permanent. It will be reviewed periodically based on outbreak conditions and no later than 6 months after the October 25th implementation date to assess its continued need. But it will likely be needed until disease rates come down, hospitalizations are at a more manageable and stable level for our healthcare system, and more adults and children are vaccinated and protected from serious infections. Although the future course of the pandemic is uncertain, ultimately its impact on our lives will diminish. And we will live with this virus while limiting its impact on our health, our ability to do the activities we value, and on our schools, our businesses, and our economy. But COVID-19 is not going away soon, and we are entering what could be a very rough fall and winter with levels of transmission that are way too high right now. Along with wearing good quality, well-fitting face masks in public, improving indoor air through ventilation, filtration, and UV technology, through distancing and limiting high-risk activities, vaccine verification will further reduce infections and hospitalizations, save lives, and help get us where we all want to be sooner and more safely. I now welcome to the podium the Mayor of Seattle, Jenny Durkan.
Thank you, Jeff. Thank you, Executive Constantine. You know, from the very beginning of this pandemic, the city, the county, public health, the State Department of Health have been connected and speaking with one voice. But we wouldn't be able to do it without the residents and businesses, the healthcare workers of this great city and this great region. And we are here today to continue the partnership with those partnerships and to keep Seattle and King County safe. We've come too far, and it has been too hard for us not to do the right and smart thing now. We are the first region in the country to experience COVID-19. And I'm sure, as you recall, at that time, we had a president who didn't believe in science and lack of national leadership. We had to decide how to respond to this once-in-a-generation challenge. So we innovated. We secured testing supplies from our international partners. We entered the Hunger Games to make sure our healthcare workers could have PPE and the supplies they needed. We launched a national leading testing program and infrastructure that passed over 1 million tests this week. We also launched vaccination efforts that reached hundreds of thousands of Seattleites and made sure it was based on equity. So those communities hit hardest by COVID-19, both economically and health-wise, our communities of color, would not be left behind on vaccines. And we did it with great partners, Swedish Hospital, Lumen Field, community-based organizations that did pop-up clinics. We pulled together to do what was right. And thanks to this work, Seattle continues to be the city in the country that is the safest place to be. We were the first to reach 70% of people vaccinated, and today nearly 80% of our population is vaccinated. But let's remember those early days, the horror we all felt when we saw those photos of people in senior homes and their family members putting their hands to the windows, not knowing whether they see their loved ones again. The most vulnerable population we have today are the people who are unvaccinated. They risk their lives and other lives. And the people who have no choice to be vaccinated are our children under 12. We must protect them so they do not become the next place that this virus is seen. We know this vaccine works. People without vaccine are 41 times more likely to be hospitalized. 41 times. 42 times more likely to die of COVID-19. And we also know where transmission happens. It happens in indoor spaces where people aren't masked and they're close together. Despite this beautiful weather today, it's Seattle, folks. The rains are coming. We will be going inside. We need to be safe. I really want to thank Dr. Duchin for this order today, but also for his work over the last 19 months. Every step of the way thinking about what was the right thing to do to keep people healthy and safe, but also do it in a way that respected what we need to do as humans to come together. No one wants to go backwards, and this is a way for us to continue to go forwards. It's the right thing to do for our businesses, for our small business owners, for our economy, and for our healthcare workers, so you will hear a few of them. If you've been watching the news, some states like Idaho and Montana, their ER rooms are filled up. Alaska, people are waiting outside for ER rooms. They send their patients here on top of the patients they have to serve who are getting sick here in our region. Those healthcare workers need a break, and we have the ability to give them that. We know that this virus is dangerous, it's voracious, and it innovates. And we have to be smarter and innovate more quickly. This is something that everybody can do. And so, in brief, if you want to protect yourself, you want to protect your family, you want to protect the kids in schools and their teachers, you want to protect our healthcare workers, it's all the same answer. Get the damn shot. Thank you. With that, I'm going to introduce Cassie Sauer.
Hi, good afternoon. I'm Cassie Sauer, and I'm the CEO of the Washington State Hospital Association. And I want to start by expressing just enormous gratitude to Dr. Duchin, Executive Constantine, and Mayor Durkan for this order. We think it is so visionary and so looking into the future and making sure that our hospital system is protected. Hospitals all across the state are under extreme strain right now. People are losing access to care that they need. We are delaying care for things like cancerous tumors, spine surgery, colostomy reversals, all kinds of things are being delayed right now. It's a very serious situation. We're watching our neighbors. We're ringed by states right now that have gone into crisis standards of care. Crisis standards is rationing care. It's choosing who lives and dies based on the amount of resources you have. We want to do everything we can in this state to not have that happen. This should not be happening in America today with a pandemic that we can see coming and is preventable. And so the kind of action that's being taken here today by our county is tremendous. We call on other counties to take the same action. It will be very helpful to prevent the spread of COVID, which leads to hospitalizations and the huge strain on hospitals and deaths. So really just huge thanks to this county and urge others to do the same. I'd like to introduce Heather Lichens, who is a critical care nurse and is on the front lines of COVID. She's also a member of the Washington State Nurses Association, and she is here representing the thousands of healthcare workers that are on the front lines doing this every day, and so heroic and so exhausted from this pandemic. So Heather.
Good afternoon. My name is Heather Lichens, and I'm proud to be a critical care nurse here in Seattle and a member of the Washington State Nurses Association. Hospitals across the state are struggling to keep up with the influx of unvaccinated patients that enter their doors every day, and it is stretching healthcare workers like me to our breaking point. Working in the intensive care unit at my hospital, I need to be available to my patients in an instant, providing life-saving treatments and reacting quickly in emergency situations. I care for stroke patients who need my help to bathe and eat, and who are at a constant risk of falling and breaking a hip. I care for patients recovering from open heart surgery, who need me at their side if their pacemaker malfunctions and their heart stops beating. I also care for COVID-19 patients. Some are on oxygen masks, unable to eat, sleep, or speak more than a few words as they struggle for days to catch their breath. Some are on ventilators, in medically induced comas, and will never see their families again. It's my duty to treat these patients the same, regardless of their vaccination status. But it gets harder and harder every day to look into the eyes of my patients, their families, and my coworkers and pretend like it's all going to be okay. More and more frequently, I'm expected to do the impossible and be in 10 places at once. Because hospitals are so understaffed, nurses, like me, are often unable to give our patients the care they deserve in their most desperate of moments. Throughout this pandemic, healthcare workers have become exhausted, angry, traumatized. Many have chosen to leave the workforce to focus on their own personal health. Those of us who remain want to continue caring for you and your loved ones, but we can't do it alone. We need everyone's help to reduce COVID-19 cases so that we can continue to care for every single patient. I want to applaud the steps that Seattle and King County have already taken to keep us safe. Because of policies like the one announced today, we have a shot at slowing the spread of coronavirus. Nurses and healthcare workers have watched with trepidation as large gatherings have resumed. Ensuring individuals together in indoor spaces and large events are vaccinated will help slow the spread and ease the tremendous pressure on our healthcare workers and hospitals. This is about protecting our community, and we all need to do our part. Thank you.
Hi, my name is Todd Miner. I own Nana's Southern Kitchen in Kent, Washington, as well. We opened up a brand new location in Covington, Washington. Nana's is based on the legacy of my great-grandma, Myrna. We use her food to bring people together. We learned so many life lessons working with her in the kitchen, and she had a unique gift of making sure everyone felt welcome. The key part of feeling welcome is feeling safe. At Nana's, we have an opportunity now with the vaccine verification mandate to continue to personify the great legacy of my great-grandma. If you choose to disclose your vaccinated status or show the necessary paperwork showing that you were COVID negative, you'll have the opportunity to dine in at a restaurant and experience a terrific service and outstanding hospitality. If you make a decision not to disclose your vaccinated status, or you choose not to disclose that information, you will continue to be served via takeout, a world-class takeout experience, one that we feel like we frankly mastered over the last 18 months. I mentioned my great-grandma. She taught us so many life lessons. One was like in times of uncertainty, times of strain, times of extreme pressure, find the space to be kind to one another. I invite each and every one of you to keep your community safe and take the necessary action to do so. I want to introduce Nate Dwyer from the Seattle Theater Group.
Hi, I'm Nate Dwyer, COO of Seattle Theater Group, home of the Paramount, Moore, and Neptune theaters. Seattle Theater Group is very happy to support this policy. Some weeks ago, as we were preparing to reopen our theaters, we implemented a vaccine and mask mandate. After being closed for the better part of a year and a half, as we continued to reopen and made our plans, we had to make a decision. Obviously, we wanted to reopen our industry, get artists and arts workers back to work after a long time off. And we also had to consider our obligations to public health as a community arts organization. Incredibly complex time to be reopening this business, but ultimately a simple decision for us. Taking this action mitigates risk. It mitigates risk of a terrible public health scenario, and it mitigates risk of us having to shut down again. We've been shut down. We don't want to do that again. So with this, we think we have made the safest version to allow our continued existence within the arts industry. And we'd invite everybody to participate in the arts, go out, visit a museum, come to a show, have fun, and know that you can do so just a little bit more safely. And with that, I will hand it back to Executive Constantine.
Well, thank you to all our speakers. There are others here, of course, with us, and they too will be available to answer questions. I wanted to make particular note of City Council Member Lisa Herbold, as well as from the Seattle Restaurants United group, Toby Crittenden and Jeannie Chen, Gloria Connor from Connor and Company, Sean Janjua from Non and Curry in Issaquah, and Dr. John Lynch. And of course, Dr. Duchin will be able to answer your technical questions about the public health order. We'd be happy to take any questions you might have.
I guess first off, quick thing, one for you. What is the important factor for businesses that do not want to deal with asking whether or not to be vaccinated? Secondly, for Dr. Jeff,
so the question is about enforcement. This always comes up with public health orders and directives. And the answer in the practice really is always the same, which is we focus first on education, on technical assistance, on helping businesses and venues comply. Of course, these are licensed premises, so there is always recourse to more significant action. But our belief is that not only the desire to do right by public and to comply with the law, but also to satisfy the demand of the vast majority of your customers who want a safer environment will lead businesses and venues to want to comply. We know that there will be a challenge for some of them because they're just strained on capacity. They may not have enough employees. Dr. Duchin, in his conversations with business organizations, has really tried to adjust this order to account for that. I'll let him address that.
So the question is, what would I say to someone who still doesn't want to get vaccinated? It's a hard position to understand for me as a physician, as a parent, as a community member, as someone who's seen the suffering that this disease can wreak upon individuals, families, communities, someone who knows what's happening in our healthcare system, our healthcare providers stretched to the brink, capacity of our hospitals, very limited right now to care for very serious diseases. What I would tell them is it's likely that they'll either have real COVID-19 infection with a risk for hospitalization and death, or they'll have a choice for vaccination. This virus will find them. It's just a matter of time. So I'd say please reconsider, if not for your own health, for the health of those around you, your family members, those you come in contact with, the children in our community, our healthcare system, and our healthcare workers. Vaccines are safe, they're effective, and they're much, much better than getting COVID-19.
Others.
Go ahead. This is Tony Benton from Rainier Avenue Radio, and we broadcast in the interest of the diverse communities of South Seattle and other areas. Completely understand the issues going on with the vaccine. But if you have communities that geographically in some places are less vaccinated or by race or ethnicity are less vaccinated, I get it. If you can't go to a restaurant, you can get takeout. But if you're talking about going into public places like ball games, entertainment, concerts, watching your children play sports, doesn't that disproportionately affect those people in those categories like Black and Pacific Islander who are less vaccinated? Does that create a situation where it exacerbates the problem of what may be seen as another form of discrimination, another form of lower access? Because if you don't have your vaccination, for whatever reason, you now also don't have access to go do some of these things that other folks can do. Or what are your thoughts about that? And what would you say to the perceptions that may come up because of what may be seen as a form of discrimination and lack of access?
I can speak less to the perception than to the reality. We've been tremendously conscious of racial disparities in infections and then in vaccinations throughout the course of the pandemic. And public health has worked very hard with community-based organizations, dozens of them, to increase the vaccination rate in communities that have had the lowest vaccine rates. And happily, a few weeks ago, we reached the point where we had 70% vaccination in every racial and ethnic group that is monitored and reported by public health in King County. A great achievement, but not a place where they're going to stop. And looking at this policy, Public Health's Pandemic and Racism Community Advisory Group engaged the public and community groups and faith-based leaders across the region. And one of the reasons, and I'll let Dr. Duchin speak to this a little bit more, Jeff, but one of the reasons that the effective date of this is not immediate, as it was in some other counties, but is more than a month off, is to provide additional opportunity for us to be able to get vaccines to those who've not yet had the opportunity to get vaccinated, so they don't have the consequence you were talking about of people not being able to fully participate in the life of our community. It is a tremendous challenge to make sure that people individually are safe. It's also a tremendous challenge to make sure that our community organizations and institutions continue to function in the context of what would be an evolving pandemic. Delta is not the end of it. As Dr. Duchin said, predictions are that it's actually going to get worse. And what we need to do is really redouble our efforts as a community to make sure everyone, regardless of race, ethnicity, income, geography, has gotten the opportunity to make themselves and their families safe, and their community safe. And Dr. Duchin, I don't know if you wanted to speak about the equity considerations and the community engagement that went on in the formulation of this public health order.
And again, my question was in regards to access based off of your ability to show your vaccination. And if you don't have that, you're not going to get access. And is there any consideration to what that, and how will you deal with that situation? Again, where certain groups, because of their lower vaccine rates, will not be able to do things that other people can do.
Hi, Tony. Thanks for joining us today. So, there in King County, as the executive said, we now have over 70% of all racial and ethnic groups vaccinated. So the majority of people, the vast majority, will have access should they choose to participate by just showing their vaccination access. Or anyone who's not vaccinated can also be tested and get access. It's not absolute prohibition of participation. It's a choice between getting vaccinated and showing a vaccination record or being tested. We also hope that this will help to motivate people who haven't been vaccinated yet but are on the fence to get vaccinated and to understand that this is not permanent. This is a temporary measure that we hope will not be necessary for the long term, but is meant to protect the very communities that have fewer vaccinated residents, because they're at highest risk and have more susceptible community members to the severe outcomes of COVID-19. Okay. I understand that there are communities that will have fewer vaccinated people, and it will be more challenging because they'll have more people who will be needing testing if they do choose to participate in some of these activities. It's not exclusively communities of color. In Southeast King County, we have white communities that have lower vaccination rates as well. But I think everyone needs to understand that the point of this is that we protect one another, and that this is not a long-term solution, that this is something that potentially can be necessary only for the next fall and winter season. We're lucky, and that people do have the option to test if they choose not to be vaccinated, and that we've taken great pains to avoid some of the essential activities where people gather, such as religious services, and not interfere with their ability to do those types of activities. People can get takeout. I understand that that might be a bit of an inconvenience, but if folks choose to be vaccinated, they can choose to be tested if they want to dine in. So I hope people understand that this is, if they're making the sacrifice, it's for the good of the children and the other community members in their neighborhoods.
Others? Yes, sir.
Yeah,
Good to see you.
Good to see you too. I want to extend our lives to the mosques, like Friday prayer, when they gathered, sort of they break together.
So this is a question about religious gatherings, Jeff.
Yeah. Friday prayer.
The religious gatherings are not required to adhere to the vaccine verification program if they're in houses of worship. If they choose to hold religious gatherings in a restaurant, for example, then that would fall under this requirement. But we took special consideration to the feedback we heard from the faith community. It wasn't unanimous. There were some faith leaders who welcomed this requirement. And of course, we encourage all communities of faith to be vaccinated. And it's certainly the right of any community of faith to require vaccination to enter their house of worship or where they gather. But it is not a requirement for faith-based communities at this point.
Two more. Are there steps being made to improve vaccination verification, like maybe with an app, or can you talk about that?
So first off, the proof of vaccine, we're taking a very broad approach here, partly because of equity concerns. We want to make sure that we don't impose unnecessary barriers. So you can bring your physical card, you can bring a photo of your physical card, you can bring a copy of your physical card. We want to make sure that it is easy at the outset here to do this. The state is working on a technological solution, an app, which would be both easier for the individual and easier for the businesses to be able to do automatically. And that should be available as soon as the end of the month. The state does not have the records of everyone who's been vaccinated. My understanding is they have about 2/3 of folks in their systems. Other folks' records are in other systems, and of course you have your physical card to prove that you've been vaccinated. But that is on the horizon, that is coming. It's not ready to go quite yet. Yeah. And I will let Dr. Duchin answer that question.
The question is, if someone has previously had COVID-19, can an antibody test be used as entry criteria? At this point, no. If this policy needs to be continued for longer, that may be possible. The challenge here, I welcome my colleague, Dr. John Lynch from the Harvard Infectious Disease Division to weigh in as well. But the challenge here is that there is no right now standardized antibody test that correlates with or is accepted to correlate with protection. We know that some people who become infected develop very good protection that is durable, may last 3 months, may last much longer. We don't know yet. It's still an evolving area of scientific study. But not everyone who has COVID-19 will develop durable immunity, and not everyone who develops COVID-19 will develop immunity against new strains that may appear. So because we don't have a reliable test that is standardized and accepted for this purpose, we cannot include that as part of our program at this point.
Question. I have a question about, you mentioned at the beginning, executive, about talk about increasing more capacity.
What kind of capacity?
More.
Oh, more, yeah. So this is, yeah, so public health has had to, again, because of the very high number of hospitalizations and deaths, as we've seen in some other parts of the country, even last year, there's starting to be a concern about inadequate more capacity. We hope we do not reach the point of actually having to have additional capacity. The public health began reaching out this morning to hospitals to help them understand how to increase that capacity if it becomes necessary. And I would ask Dr. Duchin if he has additional information about that outreach effort to tell us about it.
All right, thank you, everyone.
Almost. Just in a nutshell, I haven't had a chance to talk with the team that's doing this work. It's part of our planning. Just as there's planning going on across the state now around the potential need for crisis standards of care that you've seen, invoked in neighboring states and across the country because the healthcare system is overwhelmed. We're doing a lot of planning here in Washington State for the same contingency and doing everything possible to avoid that. But this planning that was going on this morning is part of that type of preparedness planning, and I have not been in touch with our team since then.
want to thank everyone for being here. Let you know that all of our guests will be available for individual conversations, and to just remind us all to continue to observe all the rest of the public health recommendations as well. To mask, to wash, to provide social distance, and ultimately together we can both protect health and keep our economy and our community moving forward into recovery. Thank you very much for being here.